I am Charlotte Sutton. I'm the Health and Science Editor at the Philadelphia Inquirer, and I'm also a board member of the Association of Healthcare Journalists. And on behalf of both the Philadelphia Media Network and AHCJ, I'd like to welcome you all to what I expect will be just the start of another fascinating chapter in the story that never ends. Tonight we've asked some of our region's top health policy experts to share their wisdom and their informed speculation. Since we are primarily a gathering of journalists, we've asked them all to think about what would be some themes, some story ideas that journalists could be looking toward as this whole situation unrolls.
I think there's been so much attention to everything related to the health insurance marketplaces and exchanges. And one of my fears is that discussions around the Medicaid program get lost in the shuffle of the public debate. And so that program, in my mind, is one that is certainly in the crosshairs in terms of thinking about what will happen to it, both in terms of whether it will continue to exist in the form that it exists today, whether the way that program is funded will be shifted heavily with responsibility to the states, or whether or not populations that have benefited from creating a more universal income eligibility standard will be shifted over to the private insurance market. So I think what happens to the Medicaid program matters a whole lot and impacts people who are some of the most vulnerable populations in our healthcare system.
First of all, I want to say at the beginning that I'm in favor of the broad outlines of Obamacare. My PhD thesis from 50 years ago talked about income condition premiums. I wanted to mention that because now I'm going to be critical, and there's a joke that says if you have an economist for a friend, you don't need an enemy, because they'll tell you what's wrong with you. So I will make some critical comments, but I want you to know my heart is in the right place. Most of what I think has been omitted is probably not so interesting a story. It's the people who actually are going to gain from a repeal, whether or not there's replacement, and there are going to be millions of people who will gain. What I think is frequently neglected is to note that although the number of Americans that are potentially affected by the repeal and replace, or repeal and not replace, 22 million or 18 million or whatever number you're thinking of, it's millions of Americans. As a fraction of the total population, that's trivial. That's about 3 to 5% of the population, only about 3% of the population in the exchanges. And so the message is for the average American, this is really, you don't really have a very big dog in this fight. You do to some extent, because you will be paying taxes, or maybe not paying taxes, depending on what happens with health reform. But at least in terms of your own insurance coverage, which the great bulk of us get through our job, and if we don't do that, we get it through Medicare, which Trump has said he won't touch, or even certain parts of Medicaid are going to be off limits, like CHIP program for children. All of those people are, at least so far, who knows what the unintended consequences could be, but so far they don't really have a reason to be upset one way or another. Now, the reason I favor health reform actually was because I figure it's going to cost me about $2,000 more in taxes, but I thought that would buy me a clean conscience, because the number of uninsured would be greatly reduced, and that's what I've been worried about. So in that sense, I have a stake in it, but in a self-interested, pure economic man sense, I don't.
In terms of ACA, whether it's talking about on the commercial side or in Medicaid, there are some really good things that have come out of the reform, separate and apart from adding 20 million people to the rolls. Some of the things that me personally, that I'm very proud of, are that with the addition of children up to age 26, we've seen almost a doubling of the cost and utilization for substance abuse treatment. We know we have a massive problem in this city. Nearly 900 people lost their lives in Philadelphia this past year as a result of opioid abuse. And I don't know how bad it would have been if those who accessed care would not have had access to care. It could have been worse. That's one example of where a repeal could have an impact, and we should think about what those impacts are to the citizens of this region and the country. One thing that I really don't like is the experience that people have. I often talk about and try to aggravate the provider community when I talk to them by saying, you know, we have very, very high cost, very, very high utilization in Philadelphia. We actually have average quality in aggregate. We have centers of excellence, that's true, but most care is delivered in hospitals that look a whole lot like hospitals in other parts of the country. Citizens of this region have not a whole lot of complimentary things to say about the coordination of care and the overall experience. They all like their doctors, for the most part. They all like their hospitals. But getting from point A to point B and eventually through the entire care delivery system is disjointed, poorly coordinated, and oftentimes leaves people hanging and nervous and uncomfortable. So when we talk about rolling back or repealing aspects of the ACA, I worry about the catalyst that got the ball rolling, and will that now diminish?
We don't know what will be the proposal that ultimately really gets debated. And at this point, I have to go back to the House Republicans' Better Way document that came out last summer, which Representative Ryan and Representative Price sort of bought into. And I want to talk a little bit about the key concepts there. And Mark indicated that the problem of pre-existing conditions, and he's written a lot about this, is not as big as sometimes people imply. In fact, it's probably far smaller, but it's an important issue, and I think politically it has a weight that's far disproportionate to its effect in practice, but that's by itself makes it important. The Better Way proposal basically says, if you are covered, you will be able to get coverage in the individual insurance market at standard rates. You will not have a premium based on any health condition. You won't have exclusions based on health conditions. So you'll have guaranteed issue at rates that don't reflect health status for anybody who's continuously covered. The second thing it says, and whether this sticks is your guess as good as mine, but there will be a one-time open enrollment period so that people without coverage currently will be able to get coverage without having their health status taken into account. What it does is that proposal then leaves gaps. It basically says if you don't sign up when you have the chance, and if you don't maintain continuous coverage, then if you go to the insurance market, you might face rating based on health status, you might face exclusions, waiting periods, and so on, and there'll be gaps and there'll be people that fall through the cracks. Now, that's sort of the old story here, and the states have done this. The stopgap, the safety valve for those people will be, in principle, some form of high-risk pool, where people will have access to coverage at a higher premium, some basic plan, and what that would do in theory is it will help take the people who wait to buy coverage, who don't maintain coverage, they get sick, they will be in part separately funded so that people that are in the guaranteed issue market won't be paying higher rates for those people. And I think high-risk pools are heavily attacked, and their performance in the states was very sketchy. They were underfunded, there were often waiting periods. I think people will agree that if that model is to really be effective, you're going to need a lot of money.
As we know, there's a lot hidden in the ACA, and 90% of the coverage is about the exchanges. But in terms of the number of people, the Medicaid expansion is more important. The Medicaid expansion is also more important for providers because a lot of hospitals rely on that, and pulling that out that could have serious ripple effects throughout the healthcare system. Some of the other things for your employer coverage. The ACA got rid of annual and lifetime caps. It added mandated coverage for autism. It mandated an appeal process if your insurance company turns down coverage. So all of that would be affected. Hospitals are seeing changes in Medicare in terms of ACOs, bundled payments, penalties for readmissions, and have changed their way of doing business in a lot of ways. Women's right to choose an OBGYN, mental health parity. subsidies for small employers, training for physician assistants and nurse practitioners, the premium rebates you get if the medical loss ratio is too high for your insurance. So there's a lot there hidden below the surface, and there are going to be constituencies for that. The other piece that never gets talked about, and I'm just assuming it wouldn't get touched because it's too essential, is the generic biologicals, the Biosimilar Act, which allows this whole new pharmaceutical market, which is now taking off. 2 or 3 of them have been approved by the FDA. That is because of the Biologics Price Competition and Innovation Act, which is within the ACA. If you really just root and stem pulled out everything, you would then eliminate, you would then seriously disrupt, certainly, the biologicals market. In terms of what I would be interested in seeing coverage on, what about the effect on economies of cities and towns? Philadelphia, as we know, relies heavily on medicine it's a very labor-intensive industry. What is pulling out Medicare, Medicaid rather, changes to Medicare, what is that going to mean for the people who are employed in hospitals and for the economic ripple effects? What about some of the smaller towns that rely on a hospital as their economic mainstay? What other social effects will there be in terms of public health, in terms of being prepared for the next epidemic? What is it going to mean for people, entrepreneurs who go out and start their own businesses? And there are some number of those who have been able to do it because they could get their own health insurance. So none of these groups are going to add up to the 15 million. But each of these groups are going to encompass some substantial number of people who will be affected. And I think it would be very interesting to see what happens to each of them, whether the Republicans decide to just leave this stuff in because no one really follows it that much anyway, or whether there'll be a complete wash and a lot of this stuff will go as well.